We have 5 categorical surgical residents in our program, and then we usually also have 3 or 4 preliminary interns every year. The residents do a broad mix of general surgery rotations across the spectrum of types of cases, so they get a really broad mix of cases and different types of rotations, from vascular surgery, endocrine, surgical oncology, trauma, critical care, pediatric surgery, really the depth and breadth. We have a burn rotation and we have a transplant rotation, so we really have pretty much every rotation that the surgery residents could possibly need for their training.
They, give you autonomy here very early on. They're always pushing interns into the OR, so that we start our operative skills soon. And then our program really does care about the wellness of their residents, and I feel like that's exactly what I wanted in a surgery program.
The patient population here in New Orleans is somewhat unique. Our residents really get to take care of a broad spectrum of patients. We don't have very many fellows, so our residents really don't have to fight to get the big cases, the awesome cases. So the chief residents are doing the Whipples and the esophagectomies and the big trauma cases. So that's something that most of our residents have really this is one of the things that have drawn them to our department. You're going to get to do amazing cases, and you're going to get to see the unusual things that a lot of people don't even ever get a chance to see in training. But our residents also go to community hospitals in the area and do a lot of bread and butter general surgery. So they get a very high volume case experience. Most of our residents graduate with between 1,100 and 1,200 major cases.
We get to know a lot of different systems, including purely academic centers and semi-private centers. So you kind of get to experience a wide breadth of different ways to approach surgeries, the surgical demographics, and how services are run. And this can help inform your decision of the kind of career you'd like to pursue in the future. Now, the benefit is that because you are rotating through so many different hospitals and systems, you actually end up learning a lot of different EMRs, which I feel is one of the biggest barriers in residency, is figuring out how to get things done.
There are a lot of research opportunities in our department. We do a fair amount of research in trauma, in surgical oncology and endocrine surgery, in surgical education, in minimally invasive and bariatric surgery, in transplant surgery. We have both basic science and clinical research opportunities.
My first rotation was actually plastics and breast surgery, which I got to work with really great faculty here. Actually the second day when I came here, I got to do an IND for breast abscess, and I got to do it all with the attending, and it was great.
There's not a lot of room for observation in residency, especially not in surgery residency, so it has been pretty intense. I'm a second year now, so we're operating more, but even as first years, they try to get you into the OR as much as possible.
Our graduates have gone on to all different kinds of fellowships over the years. We have a list on our website that you can look at that goes back to a year or so after Katrina. But in that time frame, the past 15 years or so, our residents have gone into pretty much every specialty you can think of, be it pediatric surgery, trauma surgery, plastic surgery, really the depth and breadth of all the different types of fellowships. The culture in the surgery department is something that we're really proud of, that we've been very intentional about and thought a lot about how we want it to be. So it's something that we actually talk about a lot.
To me, everything special about Tulane is all in the people. The people wherever you go will make the program, will make your experience, will make every single day of your life better or worse. And for me, the people here I knew would make it better. From my co-residents to my upper levels to the interns, everyone's just phenomenal.
Tulane was the first choice for me when it came to being a part of a family in my 5 years of residency. Of the places that I interviewed at and looked, I think from the interview session, it was clear that the residents as well as the faculty were all part of a really great family. There was a lot of great communication between them that I could see. And now in the program, I'm able to see the same thing, but tenfold.
If you want to be happy as a resident, I think residency is very tough, especially surgery, but I think Tulane surgery is a place that you can come and, have it not be as rough.
The very first day I moved here, it was like a Saturday. I moved in on Friday. I was going out to get coffee, and on the street, I had 4 different people say hi to me and good morning. And it was such a confusing change of pace from where I had previously been. And it just made me realize that this is like a city that really feels like a big town where everyone is just very friendly.
I would say the most important thing for applicants for our program is that we really want somebody who's going to fit with our culture. We want people who are passionate about taking care of patients. We want people who are going to be passionate about taking care of each other and understand that we are a family and that we're all in this together. We want to help each other learn and help each other grow. Some of the pillars of our esprit de corps are each one teach one. That's extremely important to us because everybody can teach everybody else something. And as you grow throughout your residency, you will teach medical students, you will teach junior residents. You may teach me something as your program director that I didn't know before. So it is very important that we want you to grow as a teacher as well as a surgeon so that you can be the best surgeon that you can be and you can educate your future patients, your future residents or students if you stay in academics, and your patients and their families. I'm really excited that you're interested in the residency program at Tulane for general surgery. Whatever you want to do, whatever career path you want to choose, we are committed to helping you get there because we want it to be the best you can be. We're a fantastic residency program. We're a great place to be from, but more importantly, we're a great place to be.